So today the topic I was given is to talk about comprehensive lactation management centers and how can the quality improvement projects be useful in having a very nicely running center, and how we as doctors and nurses contribute to good quality CLMC. Okay. So as we know, WHO has already mentioned that breast milk is a liquid gold. And if you see at what are the best options for a baby, it is mother's own milk. And as you go down the order, you see that formula feeding is labeled as the worst one. So if we have to keep our babies on breastfeeding, that's the most ideal one, the mother's own milk. And when that is not available, the milk banks or human milk banks or the comprehensive lactation management centers come into the picture. So before we just go on to it, I just want to show you about our human milk bank. It was established in November 2013, and then an additional, which was the first of its kind in India, is a human milk bank, which was donated to us through Rotary in August of 2016. So like any of your milk banks and comprehensive lactation management centers, it's a teamwork, and the team, each member of the team is as important as the leader who may have established it or who is running it, or the administration. So everyone has to function hand in hand for a good functioning of this milk bank. Now, these are some of the pictures of the human milk van which we have, and it is doing a wonderful job. And initially, in the first phase of the COVID, we did use it, but subsequently we had to stop it with some of the regulations. But it is something which brings about a little awareness about the milk banks and the community pickup of the milks from the various hospitals or from the homes. So when you have such facilities, there are success stories, and that gives you more motivation that how can we help our babies who unfortunately are not able to get the milk from their own mother's milk, or it's insufficient, and the human milk bank then come into the picture. We do get feedbacks from the mothers. We see the babies on follow up, and that keeps us motivating that whatever we establish, it has to sustain, it has to function. And we all members of this team have to make sure that it's not just the service we provide, but it's a good quality of service that we provide so that the babies benefit from it. And that usually ends up, all hard work never goes waste. And we were awarded in 2017 the best maternal and child health award from British Medical Journal for the teamwork between various departments, not just pediatrics and neonatology, but the nursing staff, the OBGY department, the administration. And when you get these things, you know that the hard work was appreciated, but it also, there was very stringent criteria. And what I feel we benefited from is the type of quality of care that was coming out from that human milk bank. So coming to now the comprehensive lactation management centers, we have national guidelines that are already established since the year 2017. And these recommendations are made primarily to minimize the risk of the donor human milk to the recipients. So that is the quality and the safety of the donor human milk. This is a very good module which is there, and I feel all of us, including the resident nurses, the doctors, everybody should read every page of it, because it is like the comprehensive lactation center. This is a comprehensive guideline. So if any doubt, you have the answers over here, maybe which are not there, we will have it in the subsequent editions probably. So when you come to the center, what is it? Actually, it's a health facility where you will provide complete lactation support to the mothers within the hospital. And some of the centers even have little outreach facilities. Initially, Milk Bank was in isolation, but under the Comprehensive Care Center, it has now become a part of the CLMMCs, where you collect, screen, process, store, and then dispense the donated milk, especially to babies who do not have access to the mother's milk. Next part comes is can it also help mothers who have enough milk but they want to keep it for their baby for various reasons the baby is unable to feed. So some mothers are coming forward and storing their own milk. So this has also become a part of this center. So there are little different types of complexities of these things, which are called as CLMCs, lactation management units, then lactation support unit. All of them are ultimate aim is to provide the baby the best feed, and that is their own mother's milk. And when that is not there, you have the donor human milk. So different types are available. Now, whenever you have talk of quality assurance, quality improvement, it starts from the conception. So if you have a very solid infrastructure, giving good quality care out of that milk bank is going to be very useful. And these are there in our 2017 guidelines as to how that milk bank should be planned. And at the planning stage, it is not just the administrators and doctors. If every nurse who is going to be a part of that center is involved in the planning, there is a sense of belonging which comes that I was there right from the beginning and I have to make sure it is sustained and in a good way. So there are important things when you are planning for a milk bank or a center. There are certain guidelines which they have spelled out, and they are like how you build your own home. You fall in love with it and you want to do the best way it should be. So that's how the basic starts from. The quality starts from a good outline or a good layout of the center. Now, PATH in 2019 has given out this particular booklet, which is an excellent book for quality assurance. And they have given us certain templates like how to audit your own center, especially the human milk banks and the comprehensive lactation management centers. And the basic idea of coming out with this module in 2019 was to help the milk banks self-evaluate them. Every milk bank or the center has certain SOPs. Are they adequate? Are there some gaps in it? And that's how this particular booklet is going to help. This is the second book. I would recommend everybody to go through it because in this short time, I may not be able to cover everything. And primarily, I have based my thing on how we can help self-evaluate ourselves, our practices, and in the bargain we make sure that there is a good quality center running in our place. So whenever you start of quality assurance or quality improvement, we should know what is that functioning of that particular center. So here we screen the donors, then those who consent, we collect the milk, we process it, especially the storage, pooling, pasteurization, etc. Then for bacterial contamination and safety, the milk is tested. There is storage of the pasteurized milk and then we dispense. So we need to know these steps because subsequently we have to go for what is the flow which is practiced in human milk bank. It may slightly vary in the plan, but the steps are going to be the same. So we will just have a quick look at it. The one in the orange, they are where the person, our nurses, doctors will come in contact with the donor. That is the donor recruitment which is there. whether the donor after screening passes. If they pass, then the milk is expressed. If they don't, then you support counsel. So the mother who is unable to donate should not be felt like offended, or she should not be made to feel that she has not done something right by not donating. It's absolutely voluntary. So even if they don't want to donate, they need to be counseled and given lactation support. Now, there is another place where the milk can come, and that is from the milk that is expressed here at home. It is transported and then it is brought into the milk bank. So these are the places where you can have the donor contact, which is there, and the transportation. Then comes these blue squares which are there. They are milk handling and processing. And this is the place where we have to look at the quality assurance that the milk is, when handled, is taken care of properly. So all this thawing, treatment, pasteurization, fortification, and unfortunately, if you find on screening that it is contaminated, it leads to disposal or discarding that milk, and it's a great loss for everybody because every drop of milk counts. Every drop of milk is beneficial to the baby, and we don't want it wasted. So when you have contaminations, you know that things are not going correct, and you need to look at it, and that is nothing but quality improvement. Next part comes is ongoing staff training. You have a lot of staffs who may be changing, new ones would be coming, or some new guidelines are coming, and an ongoing continuous training is a very important part of the flow of the process at the human milk bank. So when we talk of quality management, quality assurance, quality improvement, what is the basic idea? It is in a human milk bank context, it is that the quality and safety of the distributed human milk. You have collected it from a donor and you are going to give it to a recipient. So the quality and safety has to be maintained. When your center has a quality management protocol, the idea is that things are standardized. There is a rational reasons for why you are doing it. And when you have some problems which you come across, you will solve them, and you want a continuous improvement in service. You don't want to continue what you started. Every day you want to improve it. And this makes us all who are participating to have a systematic approach, that it is not haphazard, it is not as and when you want it, but everybody learns to become systematic and much more organized. And what are the benefits? It helps us to review our performance, our own performance, the processes which I showed you, are they all running smoothly? It also helps to control the cost of running a center like this, which is quite expensive if it goes into the details. It also improves the meeting of customer needs. What does my baby need? What does my mother who is unable to feed needs? Can I provide the milk for that baby from the human milk bank, which is safe? That's what it actually helps in, and also develops employee knowledge. As you keep on doing the quality improvement projects, you are also learning side by side. Now, what we want to do is, when we talk of quality and safety, is that the milk which is collected from the donor is microbiologically of a good quality and safe. Second, it has all the ingredients that are necessary for the growth and development of the baby, and that certain processes may reduce this slightly, but on an average, it should be adequate for development. And second, last but not the least, is the efficiency of our functioning. Now, when we are running all these centers, and especially in context of human milk bank, we should never forget that our first aim is to promote, support, and protect breastfeeding. Human milk bank can never replace mother's own milk and breastfeeding, and that should be a priority. Secondly, some mothers do need assistance during breastfeeding that needs to be offered in these centers. and offer human milk to premature and hospitalized babies. That should be the primary priority when you have such a center. So it functions as a system, any organization, and it has its own processes, it has its own points of quality control and assistant processes. So what are they based on? Now, these actions which are there, quality is based on actions that allow us to monitor the performance of whatever procedures we are doing, how we are working in a center, how we are interacting with each other, how is our interaction with our mothers, the babies, etc. And when you are doing it, what the results which we get, the quality actually tells us whether our results which are we have are of good quality, have we improved over the previous ones, our interventions are working or not. So it helps us to assess our outcomes. And when you find that some particular intervention has helped, you will review your original methods and maybe the newer one is adopted. So every time we are learning with every cycle of a quality improvement project, we are improving. That is the basis. Okay. So coming to how we can do quality improvement, the literature search showed me that there are certain 9 tools which are there, and they are listed over here, starting from critical analysis, risk management, and a very important one is hazard analysis and critical control points, information technology, benchmarking, checklist, flow mapping, educational action, and so and so. So all these words seem very different, and some of them we have not heard about it. But these are the tools which we can use to have quality improvements in our center. It's not necessary that the doctors should be doing it, or administrators, or only the staff nurses. We all have to use what is appropriate tool for what process we are going to handle. So let us look at some examples. So if you look at the first one, a checklist. We all have checklists. We have it in our homes also. We have it in the operation theaters. We have it in the wards as well. Now, in context of human milk bank, we can have a process where we collect the raw milk and we transport it. So if we make certain checklists which spell out that the milk should be collected in this way, you have to label it, you have to keep it at a temperature. So is it at appropriate temperature? Is it stored well? Is the container clean, etc. So there is a checklist when you start collecting it. So we have to prepare these checklists. And as far as human milk selection is concerned, like you have a donor, is the donor healthy? Is the donor having any infection? Is the donor willing to it? So that checklist, if you tick, and as you keep on using a checklist, it becomes a part of your routine, and you don't need to each time think what is the next step. So these checklists are used basically to improve the process over a period of time. Second intervention or a tool was educational action, where you educate the person, especially in human milk collection. You may have to educate the mother how to collect the milk, how to express it. So she will have to be shown different methods. So also the nurse who is using the pumps, or the mother who is using. So whenever you educate somebody, you end up actually improving the process, and in the bargain, it also improves the quality of your outputs from the milk bank. Critical analysis is something where each step of the storage or pasteurization we do is critically evaluated as per the standards which we can find in this path document. So whether all these steps are followed or not, you analyze it, where were the faults, are we doing it together, and that is where you will improve. information technology is the era in which we are all a part of it. And in the process of pasteurization, and in fact, in all the processes, we can actually use this for continuously monitoring our results. We can connect it to our iPads, we can connect it to our telephones, we can have all these things available handy. There are various apps which are there. So all these information technology tools also can help in quality improvement. I showed you one flow chart, like how is the flow of the milk from the time we collect it to the time it is received by the recipient. And if this thing is mapped, like how I showed you in the earlier flow chart, this always helps in monitoring if where exactly things are going wrong, whether we can improve there or we are doing a right thing. And the last but not the least is the hazard analysis and critical control points, where each and every process could have this. And basically, it is to prevent errors. It's more of a preventive tool. And if we are failing, that also could be taken care of. So it's basically a prevention method. Now, what are the different ways where you can apply this last method? Because that is something which is new, and I would like to just show a few slides about it. It is the only tool for risk management. The rest of the things what we have seen are primarily for improving of the processes which are broken down. But here it is the risk that you don't want to have any risk, how to avoid it, how to avoid failures. And it is basically for safe and high quality human milk. So this is a diagram which tells you what exactly the HACCP means. It starts from a team assembly. Then you know the process of the whole human milk bank flow. You know who is going to be the recipient. It is our babies who unfortunately cannot get the human milk from their own mothers. Then you will draw the diagram, how the process is going to be. You will ask somebody to verify it or as a team verify it and list all the hazard points where things can go. So you have to anticipate that this is the place where the milk is likely to be contaminated. This is the place where pasteurization is likely to be inadequate. So all these critical points are written down. Then there is also, once you write down, you have to have how are you going to monitor it, that whether I am doing the right thing or not. And then document whether deviations have occurred and how you can correct it. And then once you have gone through this, you should have a verification process and record keeping and documenting. So if you look at this side, I've just given you an example. Pasteurizer is the main machine which is available in a human milk bank, or milk is pasteurized and then only given it. So it has certain time periods, temperature is there, whether that temperature is maintained or not. So all these things, first you will have to prepare it for ourselves. These are there in our guidelines available. So HACCP is nothing but 12 points which you will first establish, find out the critical points and work hard on it so that you don't fail on those points. So if a temperature has to be maintained, yes, it has to be maintained 62.5. It has to be maintained for how long, etc., especially when you are checking these machines. So that is one method which, and this is one which is very popular now and people want to use it because it is a preventive way of having a very good outcome. Now, tools for monitoring the results are benchmark. Am I as good as what is being put as a benchmark, or is my center as good as the center which is there in other city, and what new things they are doing which I can take. So benchmarking is you are comparing yourself with something which has been given as guidelines that this has to be achieved, and then only you are going to be labeled as a quality center. Analysis of quality indicators in information systems, they are already available. You have to just compare your outputs to that and see whether you are above it, on it, or you are below, and you need to upgrade yourself to come to those indicators. Now, when you talk of milk bank or a comprehensive lactation center, it is not just the machine and the donor and the recipient. There are a lot of staff working there, so you need champions. Now, these champions, how do you assess that they are of good quality and whether they are doing their jobs properly or not? You should know who all is a part of your team. Now, these are any center functions if you have a dedicated staff. You have a floating population, there is likely to be some mishap which can occur if they are not properly trained. So the quality assurance starts from the staff also, then the facility which I showed you, that if the space, the construction itself is good, it is very easy to keep it clean, water, ventilation facility. So there are certain guidelines which are already given up. Like I can tell you that benchmark like things. So these two booklets, our own 2017 guidelines and 19, have given what all things like waste disposal, pest control, everything, room temperature. So every time you go into the facility, you have to make sure that all these are in place. Coming to the equipment part which is there at every part of the process, at milk expression, screening of for bacteria, etc., you have a list of instruments and how these instruments should be and how to maintain the quality. Especially you need logbooks, you need documentation, you need manuals, you need to make sure that the electrical, water connections, etc., are good, thermometers are in place. Then you have to check the thermometers that they are showing appropriate temperatures. Do they need to be calibrated? So every particular process is broken down into different areas and how to handle it, like administrative equipments, computers, etc. If they are not dusted, if they are not kept clean, they are a source of infection. So when were they cleaned, whether they are having their logs maintained, are the wires connected properly, etc. Same things are with hygiene equipment, same thing with the breast milk analyzers, etc. So we have on this side the guidelines which are there, and if we follow strictly one by one of these, the audit template has got all this. What we need to do is just make sure that at regular intervals we go through each item and tick whether we are doing it or we are not doing it, and that's how we will keep on improving. The possible places where things can go wrong is nothing but the HACC control points. So those have been outlined. Like when you are selecting a donor, the hazard is that there is a chance you may not screen properly and the infection could be transmitted to the recipient for no fault. So how do we do it? Avoid this is the proper selection, proper testing, etc. So that is laid down. Also the level of assurance. So donor selection criteria based on negative tests. So actually you should have a report in your hand which says that the tests are negative. Now, cold pasteurization, which destroys some of the infections. So we need to make sure that our pasteurization process and the machines are appropriate. Same thing is for donor consent. These are medical legal issues. We don't want people to complain later on that my child suffered because a proper safe milk was not given. So all these consent forms become very important. So that is one place where things can go wrong. Contamination can occur at another. So we need to identify these hazards, and the document also gives you how you can prevent it as well as how you have to have a benchmark of it. So you have maintenance of the temperature, then you have the bacterial contaminations which could be avoided. You also have different mixing when you are thawing it or you're pooling it or you're storing it. Things can go wrong at this particular places. Temperatures are not maintained and you unfortunately have to discard the whole milk which you have collected. If you still go down the line, you have things where medico-legal things, consent of the recipient, somebody just forgets to take the recipient's consent. And then you end up when the parents will start questioning you. So everything needs to be documented and kept in place. Next part, we go to the equipments. The equipments are a major part of any of these centers when you are talking of human milk bank. There are specifications which are laid down. So when you purchase these instruments, the guidelines should be such that they are sturdy, they are safe, easy to clean, easy to use, etc. So all these guidelines you will find in these documents which are there. Each and every thing, right from milk processing, the data logger, the different type of instrument, bottles, etc. Everything is given with the standards. So ideally need to have all these standards in place. And then we start the process right from donor recruitment. Everywhere you will find that written policy. Your center needs to have a written policy. You need some counseling, like how you find the doctors, the nurses are involved, and you need to tell. Many of the mothers don't know what is a human milk bank. They have never heard about it. So you need some material to educate them, and at the same time need to give them lactation support. When we start screening and selection, there are no shortcuts for this. There is a donor selection form. Now, this has to be readily available. Many times we just take an interview and don't document it. So, documenting is very important here. And for every step of quality improvement, you need to log this down and make sure that they are available. The consent form should be available. We can't just rely on a verbal consent. Also, the consent forms should be stored properly after they have been checked and signed, and may be kept in various places. They say to keep it up to 5 years, 10, 20 years, or 25 years till the child is 20, 18 years and above. So we don't have any written guidelines as such, but we usually are keeping it for 5 years at least minimum. Now, coming to donor education, especially if the milk is being collected at home, we need to have the education material, emotional supports, what they should do and not do while collecting the milk. So all these things are a part of your quality improvement. So you can use IEC material, you can have some flip charts which are there, you can involve the interns or the nursing students who are there, and this could be going on simultaneously in the center. Donor approval. So at present, we don't have any standard guidelines for selection and approval. Now, approval means somebody documents that I have gone through all this, checked it, signed it, and all. So those guidelines, each center has evolved, and that should be in your own SOP. That person so and so will be the person who will approve the donor, or you educate the right person, and they will be the one who will approve it. Why is this required is basically in that process you are counseling the mother, you are educating them, you are screening them, you are taking the consent, and this whole thing is becoming like a routine. It will become increase awareness as well. Next part comes in milk expression at home. The temperature is very important over here. Milk handling, storage, hand washing, how to collect the express milk. Many times when the mother is expressing milk, the other side the milk starts coming. That milk is not to be collected. Ideally, it should be the expressed milk, because here in the drip milk, the chances of contamination are high. If we are using breast pump, then we need to make sure that The mother is aware of it, the staff nurse is aware, and they use it properly as per the guidelines. So there is this education part which comes in it. Then what containers are being used? Are they acceptable? Are the lids, after using it again and again, are they airtight or they are leakages? Because that's another source of contamination. Labeling, coding, keeping it in the refrigerator and not outside. And you have to freeze within 24 hours the express milk. So these guidelines are there, they need to be documented and followed. We many times have everything in our books and guidelines, but we forget to do it. So it has to become a habit that without this the next step will not be done, without this next will not done. So need to train ourselves for it. Regarding transportation, one important thing is maintaining the cold chain. And also, if any milk is kept at room temperature for more than 6 hours, it is not accepted for donation. So there are no shortcuts over here. Because once you pool the milk, and the whole pooled milk you may have to discard just because one small bottle which was collected was mixed with it. So that needs to be avoided. So, like this, the whole document talks about milk handling, storage. The storage temperatures are given, how you should transfer the milk, how you should thaw it, etc. These SOPs have to be written, they have to be evaluated. Temperature loggers should be there, and there has to be at least twice a day you need to take the temperatures. When it comes to the raw milk, you have to have these separate four types of milk which comes. They have to be labeled properly, kept in the appropriated refrigerator so that there is no mixing. The raw milk is always kept in a different place than those which are screened, heat treated, etc. So by mistake also there should not be any mixing which is happening. Regarding transportation, one important thing is the secure containers which are there, and tracking and tracing of the samples. So again, here the record keeping becomes very important. You may have to trace back some of the samples for various reasons, for medical reasons, for medical legal reasons. So that tracking system is very, very important. When you have this tracking system, the labeling and electronic records, as well as the hygienic conditions under which the milk is handled, everything is documented. And sometimes you may have to dispose the milk because they were exposed to excessive milk temperatures during transport. You have a lot of times there are on the road traffic jams. So you expected to reach the human milk bank within say 2 hours, or half an hour, 2 hours, and it took 6 hours. So all that excessive temperatures which are the milk has been exposed to makes it not suitable for subsequent use. So these things are to be taken care of. Also, we need to remember this one thing here, that the receiving hospital takes the responsibility to complete the tracking of the milk to the recipient. So suppose you are getting the milk from a milk bank into the hospital, or you are giving it out. The one who receives it will start tracking it, that I received the milk at this time, it was kept at this temperature, at this time it was received by the baby in the NICU. So that all tracking needs to be kept in. Thawing and pooling should have the methods, everybody should be aware of it, and everything has to be closely monitored and recorded. The next step is before pasteurization. Some of the centers before pasteurization send the milk for microbiological testing, and few do it only after pasteurization. So if you find that the colony counts are very high in the pre-pasteurized one, then you make sure that you will not process it and you will discard that particular collected milk in the small bottle which is there. Whereas the pasteurization has got written SOPs like how should be the temperature, how should the pasteurization process go, lid of the pasteurized milk bottle should be controlled, the time control temperatures, etc. So all these guidelines will be available with the machine which you have purchased and you need to follow it. Because of pasteurization, some of the ingredients in the milk are not available or they get denatured. So fortification is not because you want it, but you have to make sure that infant really needs this fortifications and then you go ahead with it. Usually it is the doctors or the clinical staff who will decide about the fortification, and each center has different guidelines based on their experience. Suppose there is a milk which needs to be discarded because of contamination. You need to have a local guideline. Many times we have seen that the milk is just taken and it is put down the basin drainage. Instead of that, the way we discard our liquid waste, it should be going into that rather than down the basin, which we are very tempted to do, because after that the bottle is cleaned and then you may be reused. Okay. So whom should we give the milk which has been pasteurized? We always give it to the baby, the milk from the mother to the baby or her own baby. But if you don't have that facility and you want to choose the patients whom should be given a priority, each neonatal unit should have a written document that preterm babies, babies who are not having their mothers in available for mother's own milk, and low birth weight, extremely low birth weight. So you need some guidelines on how to use these sort of this valuable resource which is there, and only after consent. So there is a donor consent and there is a recipient consent also. So we do need to educate the mothers whose babies are going to receive it, and a very good record has to be maintained who has received it, etc., and documented and logged in. Now, milk handling during feeding. Now, even the nursing staff, or sometimes it's the mother who is giving it to the baby with a vati or a spoon, they should know how to give it. So, in this small little thing, it is wash hand, clean surfaces, etc. All these things need to be taught to not only the nursing staff who are going to feed, but also the mothers who will be doing it. So there is a continuous and documented training of each and every member of our team, right from collecting the milk to transportation to right to the recipient. So this chart over here, you don't need to remember, but it tells you at what temperature, what duration you can store the collected milk, pre-pasteurized, post-pasteurized. It is there in the document which is available. Next, we come to monitoring and auditing. Whatever we did so far, is somebody monitoring us and doing and telling us that yes, this was something which went wrong? Have we audited ourselves like every month or every 3 months or at a regular interval? So we have people within our team who can audit it also, and we can have external people coming, visiting it and telling us that yes, your processes, your documentations, everything is all right. So the facility, if you have that HACCP certification and adheres to all this, so these certifications also can be issued once you have certain external auditors or internal auditors. Now we don't have it in our guidelines as such mandatory, but every unit, if they make it mandatory for themselves, we will definitely be functioning at a very high level of good quality. Now, we talk a lot about record keeping. We want to digitalize it, but I have found that most of our nurses are very happy with registers. It's very difficult task for me to convince them that you start using the computers and all this paperwork could be avoided, but they are doing that as well as this one. So I think so it will take a little while for the entire paper records to go before we switch completely to the information technology and IT things. So we, even in my place, we do still keep records. We are slowly trying to minimize it. So let's see how it happens. And then comes for each batch, like when you collect a donor human milk, what information should be recorded, what logs should be maintained are very clearly told in the same way the pasteurized containers, raw milk as well as it. So every particular bottle or every container should have all these details on it, as well as in the documentation loggers which are there. Now, some of the centers have to report, like if we are a government organization, we need to report monthly or periodically to our authorities. So these are certain things which we need as key indicators for reporting so that we have consolidated data from all the milk banks. So it talks about the manpower, it talks about how many sick babies were there, how much utilization occurred. So all these things can be looked into. So these are the processes which are there, which we have looked at each step and where points can go wrong. So I would end it by saying that we have to develop a culture and responsibility regarding the risks that can happen where we are working. And if we can identify the risks, it becomes very easy for us to find a solution and prevent it. Otherwise, whatever actions we take, they will be just to, it's like a patchwork. The problem has occurred just now, I have solved it, and that's the end of it. It's not like that. The problem can happen again, and quality improvement is for sustainability of a good quality service that you provide. So once we do a good quality improvement project, it is implemented, it will help our management to improve and maybe expand our services. It will help us also that whatever processes which we are doing are adequate and they are appropriate as per the existing guidelines. And last but not the least, it is human nature. So quality management is an exercise that must be developed. It cannot be taught every day. You have to feel that whatever I am doing, I am going to give an output which is of a good quality itself. So it has to be a part of yourself, and you will imbibe it once you see the good results which come out of your project. You will yourself be motivated, and you will motivate others also, that by doing certain quality improvements in our every day to day management, we are getting good results and our patients are happy. So, donor milk is a gift of life that only a mother can give, and each milk drop is precious. And we are talking here of a human milk bank for those babies who are deprived of their mother's own milk for various reasons. And it's, I feel, our duty that we give them the best quality milk in the absence of their mother's own milk. So I will stop here, and I will once again thank the organizers for giving me this opportunity to express a few things in quality improvement